And welcome back. Having children, can be one of the most rewarding experiences in a couple's life. But for some women, conceiving a child may not come as easily. And joining us today from the Fertility Center of Charleston is Dr. Stephanie Singleton to talk about an option that many women are choosing nowadays. It's in vitro fertilization, or IVF. Dr. Singleton, thank you for joining us this morning.
Thank you for having me.
Now, what exactly is in vitro fertilization? We hear it all the time, especially when couples are trying to conceive and they're not having much luck. What is that?
Right. So in vitro fertilization is a process where we can actually stimulate the woman to make eggs. We can take those eggs out and combine them with sperm in the lab and then put the embryo back inside the uterus. So it overcomes a lot of the issues and difficulties that patients present with.
Now let's talk about why more women are actually turning to the in vitro process.
Right. I think part of it is because we have better diagnostic skills now, so we're able to better determine what is happening, what issues they do have. If they have a tubal factor issue, we can overcome any issues with the tubes by performing in vitro fertilization. The same thing if we have low sperm numbers. And so the male factor component is still a very important piece that people sometimes forget.
Yeah.
We can overcome low sperm numbers by actually taking those eggs, putting the sperm inside the egg, and then putting those embryos inside the uterus.
Now, how hit or miss, I don't know if that's almost like a pun, but how hit or miss is this procedure? And what is the success rate of IVF?
Success rates are excellent.
Okay.
It certainly depends upon the patients and what they bring to the table. So for every couple that present to the Fertility Center of Charleston, we're going to look at their issues individually. We're going to examine the woman, we're going to examine the man to see what might be causing the infertility issues, and then to treat them as an individual couple. But the success rates of IVF are as high as 50 to 65%. Excellent success rates. When the best success rate in a couple spontaneously out there is about 20%.
Okay.
So IVF gives couples, despite some infertility issues, awesome chances of having a baby.
Now, here's a question for you. When should couples think that they have an infertility issue? Because not everything happens right then. Some people can get married, go on their honeymoon, and 9 months later they have a baby. Other people, not so much. But what's considered an infertility issue? How much time?
Right, and that depends a lot on the woman's age and how long they've been trying. So it comes back to, if a woman is greater than age 35, then we should start looking at issues sooner. Beyond 6 months, if a woman is 35, then we probably need to see them, look to see what might be contributing and look at treatment. If they're younger than age 35, then they can go up to a year, depending upon their issues at hand. If they're not having regular cycles, if they know that they may have a sperm issue for some reason, if they know that they have issues like endometriosis, then they should probably seek assistance sooner. And their OBGYN can be an excellent guide to that.
For that, absolutely. So why, when someone's choosing fertility center, what are some real quick key factors that they should consider?
Right. Certainly they should consider the credentials of the physician that will be taking care of them, to look for a board certified physician. We also know that they want to look for a place where they're comfortable, so making sure that they have a good rapport with the physician there and with the other ancillary staff there. Making sure that they have trust in that group. At the Fertility Center of Charleston, I'm the only physician, so I'll consistently be seeing the patients throughout their treatment.
And this is your passion. I do know that. We talked about that a little bit. So how are you, and it's a little pricey, how are you helping your patients afford this procedure?
Right. That was one of the focuses when I created the Fertility Center of Charleston, is really looking at how can we make this more available to more couples, because it is a difficult and time-consuming process. It can be a financial issue. So we work with some of the drug companies to get their medications less expensively. We have compassionate care programs that really try to make this achievable for the average couple out there.
Okay, and so definitely something, if you're out there watching, you think that's an issue, then the Fertility Center, definitely give them a call. Dr. Singleton, thank you so much.
Thank you. Thank you for having me.
Have a great weekend.
Thanks.
All right, more after the break, so stay with us.